Hi everyone, this is Matin. This is our second video, posterior CUSP build-up, as you voted for on the poll on our page Matin dental course. So this is how the tooth has been prepared in the last few exams. A class 2 with buccal extension with mesio-buccal cusp broken almost in half. Like all composite work, what we need to do is to remove we're going to remove the sharp edges if we have any like undermined enamels, and then we do a bevel all around the cavity and we start building up with composite. So 260 is the bevel that we're going to use for the bevel and for most of the polishing at the end as well. So you hold the bevel at 45 degree and we give it about 1 mm bevel all around. Be careful, do not cut the adjacent piece, yeah? So the bevel should be literally all around. And even inside the cavity, we do a gentle, quick bevel. So here we go, the bevel is done, like as you can see, about 1 mm all around the cavity. And now we're ready to start building up with composite. So now you can see how I placed the mylar strip around the tooth. I wrapped it around the buccal side, 2 wedges in either side to hold the mylar strip in place. I left the mesial side a little longer than distal because every time before I cure it I need to hold this and wrap it around, so it's good to leave it a bit long so you can nicely grab it. We're applying bonding nicely with the micro brush inside the the boxes that you have over the bevel all around the cavity nicely. We do not etch here because it's a plastic tooth and it doesn't require etching, and neither in the exam. Curing for 20 seconds. So we're applying composite nicely. Usually I like ball burnisher to pack it with. If you don't want your burnisher stick to the composite, you can dip it into bonding. Pack it nicely over the cavity, over the bevel that you have, the buccal and this proximal extension, the boxes that you have nicely. Make sure you don't have any gap or void. Yeah. So you will get some excess in the buccal or occlusal, which is not a big deal. It can be easily removed, but what you need to do is you should not have any excess in the interproximal. And how you avoid that is, before you cure it, you hold the mesial again, you wrap it tight around the tooth, and then we cure it. Now I'm holding the mylar strip wrapped up around the tooth tightly, and then we cure it for about 20 seconds. We do composite in layers and in increments, you know that. It's to reduce the shrinkage and sensitivity afterward. I'm now adding the second increment. Composite, again, pack it nicely over the tooth, wherever you want it. Pack it nicely. And again, just before we cure it, we wrap the mesial around the tooth, mesial side of the mylar, and we cure it for another 20 seconds. Now I'm adding the last layer of composite. So when I do add this layer, I'll try to give it a little bit of shape, although that's not a big deal because we shape it with the burr. We always slightly overfill it, and then at the end we grind it down with the burr. But at this point, at least I can get my marginal ridge, just mark it where the marginal ridge is, and give it a little bit shape, to the cusp and the buccal fissure as well, and later on it's easier for me to now we are removing the wedges and mylar strip gently because we do not etch these plastic teeth, so the bonding is not as strong as the bond to natural teeth, so be very careful while you're removing this. There we go. Now it's the time for polishing. I'll start from where I can see the easiest, which is buccal. So and shaping as well. So we'll use the buccal now. Be very gentle. Composite is very soft at this point. So remove your burr very lightly over the tooth and composite, so do not remove too much, and constantly check it in the mirror. Make sure that the two cusps are almost in the equal level, and the cusp that you have built up just is not too stick out compared to the distal cusp. You can have your buccal fixture back as well. As you can see, I'm placing my finger in the sulcus because you're not allowed to put it on the 7, as you will be retracting the patient cheek too much, and that could hurt. So now I'm going to turn the head to the right and sit on the left to see the to do the occlusal part. So now we're cutting the occlusal and shaping the cut from the margin that we created for marginal ridge. Stop. So the tip of the bear in the central fissure, slide over the cut and then shape the cut. Don't make it too flat. Okay. Now, as you can see, the shaping with the bear is finished almost. We have the marginal ridge. We have marginal ridge. We have no excess in the interproximal. I haven't done any removing or anything. The fact that I wrapped it around every time, it helped that I don't have any excess there, so it made my job much easier. So now I can only polish it with a white stone or Sufflex disc for a couple of minutes, and the job is almost done. This is the view of the occlusal surface, marginal ridge, the cusp and buccal fissure. The anatomy, you can always look at the contralateral 6 and try to copy that as much as possible. So this video has nothing to do with selecting shades, because we deliberately choose a darker shade so it can be seen in contrast with the tooth. For polishing, we can use white stone, as well as you can use Sufflex disc as well. I prefer white stone, so you can do a bit of polishing with that. Be careful, because white stone as well can easily damage the adjacent teeth. Now the work is done. You can see cusp buildup is done, marginal ridge we have it, we have the cusp is rounded, it's not square in the corners, and we have a nice and tight contact. Obviously you're gonna have to check your contact with floss. That's the end of demonstration. I hope this can help. Thank you for watching. Don't forget to like us on Facebook, Matin Dental Course.